epidural anesthesia and the pros and cons, or the risks and benefits associated with that. I like to say pros and cons because really that's what you're going to need to do, is just sort of make a list of what is a positive about having an epidural anesthesia and what is a negative. And then based on you and your health history and your baby, just deciding if that's going to be a good decision for your labor and birth process. Some of the pros of receiving an epidural is its help with pain management, of course. So say a woman is laboring for several hours and is just plain tired and worn out and just can't get a grip on the pain that is coming with each contraction. An epidural will relieve the pain, of course. So for some women, just having less of a painful experience is automatically going to make their birth experience a more positive one and going to leave a better taste in their mouth. So that's an awesome benefit. And then two, having an epidural should allow you to rest in between contractions. For moms especially who have labored for a while and maybe they're getting that traditional failure to progress spiel from their doctor. Sometimes all their body needs is just a little rest. The stress needs to be taken off a little bit, and if she can catch a nap in between contractions, or sometimes she can even sleep through a few contractions, that can make all the difference and help her turn a corner to get that baby delivered faster. So those are wonderful wonderful benefits to an epidural for sure. An epidural can be so helpful and just the answer to a mom's problems if her trying other forms of pain management aren't working. So maybe you've tried deep breathing, maybe you've tried moving around the room, or massage, or using essential oils to help alleviate pain, or whatever your pain management choice is, but none of those are working and you have no more tricks in your bag. An epidural can come in and sort of save the day. So all of those are wonderful reasons why you would call that anesthesiologist and get that procedure on board for sure. And then there are some risks or some cons associated with an epidural for sure. Some of those include an epidural can cause a sudden drop in your blood pressure, and so therefore your blood pressure is going to be monitored even more regularly than it would be had you not had that procedure. They're just going to keep a close eye on you and also keep a close eye on the baby, so you would most likely have continuous fetal monitoring with the straps around your belly to make sure that baby's heart rate is staying stable and that the epidural isn't affecting baby in a negative way. With an epidural, you are not as mobile as you would be if you didn't have that medication on board, and so you're often going to need to rotate sides because staying in one position for too long during labor can slow things down or stall it, and you would need assistance most likely to shift from your left side to your right or vice versa. And so for some women, that right there isn't something that sounds appealing to them because they want to be able to use their legs and move as they see fit. So that can just be a con. And some women, once receiving an epidural, find it harder to know when to push. They don't have that urge that you might just have otherwise, and so they have to be instructed, and so sometimes they push too hard too soon, or they push too long, and sometimes additional interventions have to come in because the epidural is on board and mom isn't pushing as effectively as maybe she could. So sometimes that leads to the need for forceps or vacuum to get that baby out, or sometimes it leads to the need for a cesarean because mom is exhausted and her blood pressure and her heart rate are not stable, and neither is the baby's, and she's been pushing for a long time but with no result. So that is definitely a risk or a con. As I mentioned, you're not able to move on your own. And that can last several hours after the birth. So some women complain, that they can feel everything in their right leg, but it's tingly and weird and numb in the left, for example. And so you would still need help getting up and going to the bathroom, and even just being able to swing your legs over the side of the bed. That can be really difficult if you don't have complete feeling in your legs. There are some rare cases where there is some severe or permanent nerve damage done with an epidural. Like I said, that is rare, but that can be a side effect. And there are some other unpleasant side effects that can be associated with it, such as nausea or a headache or just a lot of tenderness in the area of the shot. So those are things to be aware of. So of course, with all of these things that we're going over in this exam, it's so important for you to bring your questions and concerns to your provider and just figure out if an epidural anesthesia is going to be best for you and your birth experience.